you also suspecting that you have endometriosis? If so, you're in the right place, friend. Endometriosis has been a question mark on my board for the past couple of months. I've been dealing with a lot of pelvic pain outside of the usual. I also have pelvic congestion syndrome, which is very painful. When you think of pelvic congestion syndrome, I want you to imagine varicose veins in the pelvis and the uterus. Horrible. You talk about dilated blood vessels, and on your menstrual cycle, those blood vessels dilate even more and it causes more pain. So I already deal with pain down there, but this pain is different. Recently got a diagnosis of adenomyosis. Adenomyosis is similar to endometriosis. The only difference is those lesions embed themselves in the myometrium, basically the muscle wall of the uterus. Painful as well. My uterus is about 2 to 3 times the size it should be. It's pressing on my bladder, my bowels, and my rectum. So it is causing bladder insufficiency. A lot of problems. I have problems going to the bathroom. TMI, but we're all adults, right? Very uncomfortable. So it's causing a lot of problems down there. But I have very high suspicions of rectal endometriosis simply because on my menstrual cycle and only on my menstrual cycle, I get rectal spasms during bowel movements. Very painful. So if you've ever given birth, I want you to think of full-blown contractions in the rectum area. I literally sometimes sit on that toilet and I cry. And I wonder if there are lesions there that are responding to hormones during my menstrual cycle. Another suspicion of endometriosis is the bloating that I deal with. If you look at one of my most recent shorts, my stomach was about the size that it was when I was pregnant with my twins. And they're about to be 5. Horrible. So it's like I'm now dealing with the bloating. I'm dealing with a lot of pain, and it's very hard for me to differentiate pain because a lot of my syndromes, their symptoms tend to overlap. I also have Nutcracker syndrome, pelvic congestion syndrome, May-Thurner syndrome, MALS, which is median accrued ligament syndrome, and I also have May-Thurner. I don't remember if I said that, but if I did, I'm sorry. So a lot of this pain tends to overlap, and it makes it very hard for me to figure out. For years, I have been told nothing was wrong with me. How many other people, specifically women, have been told that nothing is wrong? And years later down the line, you actually figure out you have a lot of problems going on. Everything is attributed to stress and anxiety, and unfortunately, we are the ones that suffer. I had a high suspicion of adenomyosis for years, and the OBGYN that I was seeing told me that nothing was wrong. It was seen as early as 2023 on prior imaging, but I honestly feel it's been there longer than that. So now I have to decide, do I want a hysterectomy? What do I want to do with this? I have no clue. I really don't want to get rid of my lady parts, but my uterus is taking up a lot of space down there, and it is causing a lot of problems. When it pertains to endometriosis, the biggest issue is a lot of people are saying that endometriosis cannot be seen on imaging, and I disagree. You have 3 different types. You have the superficial peritoneal endometriosis, where you have those smaller lesions that are very hard to see on imaging. But then you have endometriomas, aka chocolate cysts, which can be seen on imaging. They can be seen on ultrasound and be seen on MRI. Then you have the deep infiltrating endometriosis. I think it depends on the sonographer. I've met a couple of sonographers who know how to spot endometriosis. They know how to spot the nodules. They know how to find the lesions. It takes a trained eye. So I have an upcoming ultrasound appointment on the 24th to get another transvaginal ultrasound, but this time I want it specifically done with what they call a sliding scale. So with the sliding scale, the sonographer inserts the probe and it's like they're going to maneuver it a certain way to see, do your organs move freely? So it's called is it the pouch of Douglas or the Douglas of pouch? I think it's a pouch of Douglas. Don't quote me. I'll try to add it up in there. But their goal is to try to figure out, does the uterus freely slide back and forth like a swing? It's supposed to glide smoothly. If you have a negative sliding sign, with that, it's not going to move. It's going to be stuck. And if it is stuck, that is a very high suspicion of adhesions, aka endometriosis. Now, granted, it can be scar tissue. If you've ever had surgery, I have not. It can be a chronic sign of chronic inflammation. I think they have something called endometriosis, right? Chronic inflammation of the endometrium. So there are multiple factors, but this would help me go through the process to build up a case to see, do I need to meet with a surgeon for exploratory surgery? I am not comfortable with just jumping straight into surgery to see if I have it. I want to do as many less invasive procedures or tests that I can to build up to, hey, I really think I possibly have endometriosis. These are my findings, right? That's the process that I go through. To some people, they think it's boring. That's just a way, because my body does not respond to pain medication in the way that it should. So I don't want to put myself through unnecessary pain, because I normally cannot take the pain medications that they give. Not even a basic Tylenol. It sucks, but that's my life. So I have to work with my comfort measures and what I'm comfortable with, right? So my question to you, do you have suspicions of endometriosis? You know, what is your issue when it pertains to advocating for yourself? Are you not being listened to? Are you not being heard? Do you not have any imaging? I would love to kind of pick your brain and see where you're at, and kind of see if we can help each other go through this process. If you already do have endometriosis, and if you have any tips, please post them in the comment section to help us out.